Tribune presents the 21st annual J.U.M.P Christmas Extravaganza with guest honoree McClellan.
Hi, thank you for tuning in to Trending with the Tribune. I am your host, Sharon Hurt, and we have our esteemed guest today, McClellan, who is the director of Reach 2020. And it's so interesting because we met before Reach 2010, but we did start working together with Reach 2010 at Matthew Walker Comprehensive Health Center. And I am just so excited to have you as one of J.U.M.P's honorees this year for our Christmas extravaganza. You have done so much work in the community, and you have been tireless in your efforts to reduce disease in this community, and I just love it if you will just talk to the people and let them know all of the things that you've done for decades.
Oh man, you make me sound so old. But it's true. Really and truly, my very first job was at Meharry when I was 16 years old. I worked in dietary. And I was saving up money to go to school. And after I graduated, I started looking for a job, and it wasn't easy. By that time I had gotten a master's. And jobs in my field for people like me were not easy to find. Okay. I went to a certain place, I shall mention no names, and applied for a job as a health educator and watched the girl in HR throw it in the trash, my CV and everything. And so that was kind of painful. However, I didn't give up. I started looking again, and I was able to get a position with Meharry, working with sickle cell disease, of which I worked with sickle cell for over 19 years.
Really?
I loved it because we traveled from one end of the state to the other. We did everything from public education. I trained nurses, physicians, social workers.
You all actually had a center, a full-fledged sickle cell center. I recall
we were comprehensive. Yes, we had laboratory. We were the state diagnostic laboratory for newborns. Still is.
Okay.
And so we did everything. We went to every small town, just about in Tennessee, and we tested whole families. And not just tested, but provided the appropriate information so that they could understand what the information meant. Because at that time, I do believe 1 in 500 babies in Tennessee was born with sickle cell anemia, which can be life-threatening. And there were many other forms of sickle cell disease that people didn't understand. So I worked as a counselor and health educator there. And so, like I said, we traveled all the way to Bristol, Tennessee, all the way over down to the very end of the state where Memphis is. So we were everywhere. I worked with AHEC at Meharry for a short period of time because that's when the REACH grant came through. I said, I'm going to apply for that. I said, oh, I won't get that. But I did. And I loved that. I loved working with the community then. We worked with a lot of people. Sharon was our CAP committee chair. And CAP stood for Community Action Plan Committee. And so she was instrumental in helping put together the plan for the tobacco team.
Right, we had 5.
We sure did. And so we had people from the community to come in, remember?
Exactly.
And they came in, we split them up into work groups, and they came up with plans that would impact tobacco use or smoking, access to health care. It would impact physical activity and obesity, reduce obesity. And the other one was, come on now, you know I'm getting old, Sharon. That was another, anyway, health and wellness. Health and wellness. And so we had these 4 teams that were made up of community members. The people who, the CAP committee members were assigned to certain teams, and then we had paid staff who were serving as community health educators and outreach workers. So we were all over North Nashville, and we were doing a lot of different things that were sort of innovative.
You know, I wanted to say too, going off on the outreach workers, not only have you been instrumental in doing things yourself, but you were instrumental in hiring other people that went out to serve the community, which, you know, we get double pleasure from the work that you do. And I just think that's so important. And you, in my opinion, is one of those unsung heroes or sheroes that they might say, that you've touched the lives of so many people, and even when they didn't know it. And for that, we are grateful to you for the work that you do.
Well, I loved what I did, and I believed in the people in North Nashville. Do you know that just about everybody I hired on those REACH teams were community members?
Right.
They lived or worked in North Nashville. They lived here. And that's what I wanted to see, and I figured that bring them in from the community, they have more buy-in, they're more engaged, and they want to see things happen and see things changed. A lot of the ones that started out with us, some of them had degrees, but not all of them. But of the ones that did not have the degrees, they went ahead and got degrees.
And even advanced degrees,
and
like
advanced.
Consuela.
Consuela ended up with 2 master's degrees, and she was from North Nashville. I can't think of her name. Tuno Kennebrew had a degree from TSU, but she went on and got her master's. And when the REACH project ended, she had a job with the state. She was over physical activity. So they did wonderful things, or they got skills that they could use elsewhere. One of the issues that I had, however, was that for some of those, Dorlisa ended up in her master's in education, so it was just wonderful to see that kind of thing.
So, talking about that tobacco team, was it an impactful work that we did?
Yes, it was. There is an article printed in the Journal of Ambulatory Care Management about the success of the tobacco team, and that the number of smokers in North Nashville dropped.
Wonderful, wonderful.
Yeah, so you can tell that to your grandchildren.
Yeah, that makes me proud. That makes me very proud, because it was really important for me at that time. You know, my mother passed away back in 1999 from chronic emphysema. And she was a heavy smoker. So it was very important to me at that time. So I'm very happy to know that the work we did make a difference. It
made a difference. We had community clinics.
Right.
That, you know, they were open during regular hours. If you were a member of the working poor, more than likely you had to ride the bus to work. By the time you got off, the clinics were closed. Another thing was that if you were a member of the working poor, you were usually uninsured.
Right.
And if you took time off from work to go to the doctor, more than likely you didn't have a job.
Right.
So we were running into those kinds of issues. Consuela and the Access to Health Care team, that's who they were. They went through North Nashville, talked to North Nashville physicians, and asked them if they would see so many uninsured patients a year, they could take it off their taxes. These people didn't have the money, they were uninsured, there was no Obamacare then.
Right,
Okay.
You're exactly right.
So she had actually had them sign letters of commitment saying that they would do this. It was just I almost cried. I said, here are people willing to give back to the community. Then she went around to community-based clinics and somehow or another negotiated with them to expand their hours of operation. So we had about, I think it was 6 to 8 clinics that changed their hours. They were open in the evening several days a week, which enabled the working poor to get medical care. And they're still doing it. So some of these things that we started way back when
still continues. And that's good to know. And even then I know that while you focused on the North Nashville community, you were really good at reaching out to other people and building relationships with individuals at Vanderbilt to try to help spread all of that information as well. You want to talk about that? And then I know that you continued from 2010 to 2020, and I want you to talk a little bit about the Reach 2020 as well.
Okay, and there's some other stuff in between now. The importance of having successful projects or successful interventions is good community partnerships. You cannot bring about change by yourself.
Right.
You have to have other people who are committed to the same mission that you're committed to see things happen.
Absolutely.
And good lines of communication are important. I don't care if I'm the cafeteria worker from dietary 40 years ago,
Right.
or I have a PhD in biochemistry. I still need to know things.
Right.
How do you expect me to be healthy and take care of myself if nobody ever tells me how to do it? So you partner up with your community members, and not just your professional folks,
Right.
but the lady who brings up the groceries in the grocery store, your beautician, or the lady at the nail salon, or the man who cuts your grass. These are all people impacted by chronic diseases. So we need to make an effort, and it's never over. The work is never done, because you have people who are funded to do these kinds of things. So when the money runs out, people lose interest.
Right.
Number one, they lose interest.
That's
so
true.
we have to go towards those things in the community that can be changed for the better, for good. We have to look at the environment. Why is it that there are no grocery stores? Oh, 2 in North Nashville. Why are there only 2? You know, we eat, we buy food, but why is it that I live in Preston Taylor, and I don't have a car,
Right.
but it's hard for me to get food, so I cross the street at the Dollar Tree and I buy pizzas and things like that. Well, then I have weight gain. And I just found out that I have type 2 diabetes. Okay. But I can't get better food because I don't have a way to get to the store. If I go to the grocery store, I have to pay someone to take me, and my resources are so small.
Absolutely. And you know, with this community historically having been the highest in unemployment and the lowest when it comes to social economic status, it has really plagued this community for years. I recall being on Reach 2010, and we talked about how the Kroger that we had, and it was the only grocery store at that time, actually was built on the community garden that had been built in order to try to provide the citizens in this community fresh vegetables.
Absolutely.
So, and it's good to know that there is another grocery store, but based on statistics that I've seen in research, we should have 6 with the number of people that are here in the community.
There should be 1 within a mile of your house. You know, that's how they figure it up at the U.S. Department of Agriculture.
Right.
So if you have several miles between you and the closest grocery store, then you're living in what they call a food desert.
Right.
And that means that there's nothing there. You have no way to access the grocery store 6 miles away.
Right.
I do recall when they built the Kroger on Monroe, the community had to fight to get it.
Right.
Don't you remember that? Had to actually fight. They didn't want to put it up there. They were tearing down the old rat-infested farmer's market.
Right. Right.
But they weren't going to replace it with anything. So that meant that there would have been no grocery stores in North Nashville. And you're talking about the catchment area, because right now we're working in 07, 08, and 09. All of that is considered North and Northeast Nashville.
Right. Exactly.
So our target was like 48,000 people. And we had to actually try to reach 75% of those people, so it's about 32%. it is not an easy thing. You know, you go out and you talk to groups, you talk to people in the mayor's office, you talk to the executive director of the farmer's market, and you talk until you're blue in the face, and you go back to your office and say, what just happened? No one really pledged to help us bring this thing along. So we've been kind of pulling and tugging. Now, we had a coalition meeting on the 17th.
Okay.
I did a presentation to the coalition. I've done several. And I took them through the project from the very beginning all the way up to where we are now. And I said, we're in year 4. We got an extra year to come up with a plan on how can we sustain this initiative. And I told them about the importance of what we call PSE strategies, policy, systems, and environmental strategies. The policy means changes in laws and procedures. Systems mean we change the way we do things. And the environment is what's in our physical environment that's making us sick, or what is lacking in our environment that's making us sick.
Well, you know, I remember with Reach 2010, the mission was to reduce and in time eliminate diabetes and hypertension in this North Nashville community. Which 2020, have you continued that same mission, or is there a different focus?
The mission is pretty much the same. We chose healthy eating.
Okay.
We had different categories. You could choose to work with tobacco or access to health care only, or healthy eating, etc. So we chose healthy eating, and how were we going to do that? Through mobile markets. When I was growing up here in Nashville in the 50s and 60s, there was a market man.
Yes, it was.
He had the most beat up old truck, and it was almost dragging the ground, but that man had everything on there. He had watermelons, greens, he had tomatoes, he had fruit. You could get 3 apples for a dime. You could get 3 oranges for a dime, or a pound of luscious, delicious Concord grapes for a dime. And so he also carried other items on there, you know, our folks in the fat bag and stuff like that. He would have that on there, but you could, we as kids would take our dimes up there, and it was a treat to get 3 oranges for a dime, and they were the sweetest, juiciest oranges you could find. Then he disappeared, you know. Back then, there were a lot of people in the black community who did not have automobiles.
Right.
They didn't have cars, but you had neighborhood grocers.
You did.
Neighborhood grocery stores. You could walk to the store, your mama would send you up there to say, get a pound of hamburger or something, or a pound of ham or bologna or whatever.
Loaf of bread.
Loaf of bread, kerosene, and you could think of all these little things that people used as conveniences in neighborhoods at that time. So those people kind of fell by the wayside, so you didn't have the market man. The mom and pop grocery store became shuttered because the big box stores came.
Right.
The Krogers, the J.U.M.P markets, and the Walmarts and all that. So the mom and pop stores could not compete.
Right.
And so that kind of decimated our communities, because you did not have folks, everybody didn't have a car. There was not a car in every driveway.
No.
There wasn't. And then the bus, and where we lived, you had to go 2 or 3 blocks, about 3 blocks to catch the bus. So,
yes.
And then that's when we get down to our jitney cabs
Right.
that we relied on in the black community, because if you had a doctor's appointment, you call Holmes Funeral Home, and for 50 cents they give you a ride to the doctor. And the same thing if you had, say, you just wanted to go visit your sister across town,
You could do it.
you call Holmes or any of the others, and for 50 cents they take you to South Nashville to visit your relatives.
You know, and some of those things were just valuable and good. We could have still used those things today.
They were outlawed.
Yes.
They were outlawed by the cab companies fought it, the
Right.
city fought it, because they weren't collecting taxes, etc. And that was the black folks' transportation system gone bye-bye. In some cities, they're still doing it, but it's done legally in Houston. I think Chicago, Baltimore.
Same thing as what we know as Uber today.
Yes.
You know.
Yes. Now they call Ubers.
Right.
And they can do these things.
And you can swipe your card. You don't have to have money. You just swipe your card with it.
Exactly.
You know.
Exactly.
So now that we've gone through our 2010, what about 2020? What's going on today?
We're trying to keep food flowing
Mm-hmm.
through some of the poorest neighborhoods in the city, which are sort of dwindling because of gentrification. But there's still plenty of people out here who don't have access to healthy food.
Right.
And so that's our goal. That was our goal since 2014, and that was to find ways to bring in healthy foods. We chose to look at farmers who grow locally and try to get them interested and excited about bringing better food into our neighborhoods. It was like chewing nails, very hard, because we couldn't get producers to hold markets on Saturday in these areas or Sunday, when a lot of the working poor are available.
Right.
So our folks are out here on the weekend,
Right.
and if it's right down the street, they're gonna go down there and buy it. And some folks, I had a lady from Preston Taylor to call me, and she said, "Where's the market today? Where is it? Is it at the hospital?" We had one in the lobby of Nashville General Hospital.
Right, I remember that.
"Where is the market?" I said, yeah, we have it. It's at General Hospital. I've got to get over there. I've got to get my vegetables. So many of our elderly people had become used to seeing the markets at different places, over at Hadley Towers, teachers' apartments. So we kind of got around. Our goal was to sustain the initiative. That's what we're trying to do now. And we're trying to get people in the community who want to work with us and coming up with a plan to keep the food rolling through the community.
That is so wonderful and awesome, Linda. I'm just so happy, again, that you are one of our esteemed honorees for the Christmas Extravaganza, which will be held on Thursday, December 7th at Meharry Medical College's Cal Turner Center. We will start with registration at 11:30, and then we will start with our luncheon at 12 noon. And we've got Phyllis Hildreth, who's going to be an honoree along with you, Joe Hall from Hall Strategies, and Leonard Morton Sr., who's our Jeffersonian Award recipient this year. So I am really happy to have you. If there's any information that you need, you can contact us at 615-726-5867, 615-726-JUMP, to find out information regarding our upcoming Christmas extravaganza. You can also go to our website at JUMP.com. I look forward to seeing you, and thank you so much again, and we really appreciate you being with us this
Thank
year.
you for having me.